Okay, I'm going to be putting an ostomy bag on this stoma, and I have identified the patient. I have asked to check the ID bracelet. She gave me her name and her date of birth. So I'm going to perform hand hygiene and put on a clean pair of gloves. This, by the way, is the ostomy. The first thing I'm going to do is I'm going to place a drape over the patient's skin underneath the stoma to keep the patient nice and clean while we perform this procedure. So now, if you can imagine, I'm going to just, the old appliance has already been removed, and I'm just going to use just, lukewarm, tepid water and a washcloth to clean the stoma. I'm going to clean all around the stoma and just pat it dry. And then I am going to, once I have cleaned all around the stoma, clean the skin, I'm going to assess it. And the skin surrounding the stoma, it doesn't look irritated, so that's good. There's no irritation of the skin around the stoma, and the stoma itself looks nice and pink and moist, not actually blue. So now I'm just going to place a gauze pad over it just to prevent any leakage. Now I'm going to get rid of these gloves. Perform hand hygiene and get a new pair of gloves. The next thing I need to do is I need to size the stoma. It's a rather large stoma. And the way I'm going to do that is I'm just going to use one of these cutouts to get the best size of this stoma. And there should be about 1/8 of an inch around. So it's 64 millimeters. Then I would take the new wafer, place this onto the back, onto the paper on the back of the new wafer, and then I would trace onto the paper the size that I measured of the cutout. And then I would actually cut it out to make the wafer the correct size, and I have spared you that. I did it ahead of time. Here's the little cutout. So now this wafer is the proper size for my stoma. So I will connect the appliance first. It just snaps on. Now, before applying this to the skin, I'm just going to warm it in my hands. I'm going to apply any skin prep around the stoma, like any powders or adhesives that are needed. Then I'm going to dispose of that. And I'm going to place this on the stoma with the bag pointing toward the patient's feet. And once I've done that, I can peel off this backing. And just adhere it all around the stoma. And then I would hold this in place for 30 to 60 seconds. Then importantly, I am going to remember to clip the end of the bag with the clip that I have here. Clip that shut. Perform hygiene one more time, and then that's it.